Okay, hi to everybody here. I'm going to make a start in a few minutes, so just hang on for a bit. I'm just waiting for a few other people to come on board, so we'll make a start in a couple of minutes, okay? Okay, then we're going to make a start now. So I'm just setting myself up. Sorry, bear with me. Here we go. Okay, so for those of you who don't know me, welcome. My name's Dippin. I'm the professional support pharmacist here at Pharma Plus. Before I start, I just want to see if anybody can hear me. So can somebody out there just say yes, I can hear you, or something like that? Yeah, you can hear me. Yep. Okay, great. Okay, so I'm hoping that you can hear me. Um, So welcome. Uh, for those of you who don't know me, my name is Dippin. I'm the professional support pharmacist at Pharma Plus, and these are the series of monthly webinars that we do. Um, this time, what we decided to do after feedback from the conference last month, we decided to move the time to about 3 o'clock in the afternoon. That's when most of the people said that they felt that this was the most appropriate time for them. So if everybody here is actually okay with that, that will continue with this time. If there are any really severe objections to it, let me know, and we'll change it back to the previous time of around about 11:15 or so. So that's something for you to bear in mind as well. So if you do want us to change the time, we can happily do that for you. So today, what we're going to do is it's not going to be a very long one today, mind you. We're not going to spend an hour or so. I think at most we'll probably be spending about 20 minutes on this particular topic. And the reason why we chose it is because it's very topical, obviously, for this time of year. It's about hay fever, and it's also about the sorts of things that you as counter assistants and counter staff can prescribe or can provide to your patients suffering from hay fever. And I'm sure that most of you, if not all of you, know somebody or it might be a partner or a friend or something who actually has hay fever. I have it. My wife has it. My daughters have it, actual fact, as well. So it's all like spreading in my family, and I'm sure you know people there who have it as well. So really, that's what we're going to be discussing today, and hopefully at the end of it, what you'll find is that you'll have a better knowledge of hay fever and its treatments, and also some of the causes behind it as well. I'm not going to go over it into too much detail, but that's really what the idea for today is. Oh, by the way, I've decided to change the format a little bit as well. I'm using a different program, so if any of you get seasick while you're watching this, you'll see what I mean when I whiz through the slides. Let me know, and we'll go back to the PowerPoint presentation. I just thought this looked quite nice to do. Anyway, the agenda for today. So what we're going to be going over is really what is hay fever, what are the treatments as well for hay fever. I'm going to be flicking through some clinical components. In other words, some of a little bit of biology behind it, but not huge amounts, but a little bit of biology. I think it'd be quite nice for you to understand what causes it. and also what you can potentially do as counter assistance for your patients as well. Now, pardon me. So what is hay fever? There is actually that's actually the slang name in a sense. The actual oh dear, sorry about this. There we go. Start again. Okay, the actual name for it is called seasonal allergic rhinitis, so SAR, but that's what the technical name of it is. And it's characterized by inflammation of the nose. Now, I don't mean the nose itself, I mean the blood vessels inside the nose. And it actually affects 20% of the population, not of all people, but 20% of the population. And if we assume, say, for example, the UK population about 60 million, then you're looking at a good 12 million people or so in the UK who potentially have hay fever-like symptoms. There's a huge market out there and a lot of sufferers out there as well. And one of the main causes behind it, and that's the cause behind it, is actually the pollen count. And we'll go over that in a little bit more detail. It's not as clear cut as you would like it to be, as I would like it to be. But there are different types of pollens out there which come out at different times of month and different times of the year. And that is characterized by something called the pollen forecast. So if you look on the Weather Channel or on ITV or whenever they're doing the weather, you'll also get a pollen forecast as well as to how bad the pollen out there is likely to be, to sort of give you a little bit of an indication as to how bad your hay fever, if you suffer from it, is likely to be. So huge market, 20% of all people, and they're all coming to your doors and effectively to be treated for hay fever. So what are the symptoms of it? Again, sorry, this is making me a bit seasick. I might actually transfer it to the PowerPoint presentation the next time round. But if you are suffering as well, let me know. Anyway, what are the symptoms of it? Well, I'm sure you can probably guess for yourselves what symptoms these are. So you've got sneezing, a very common symptom. A runny nose, in actual fact, it's a runny nose full of mucus as well. So rather disgusting. I mean, you're going through loads and loads of tissues every single day. Itchy eyes as well. And it's actually typically worse on humid and windy days. Now, the reason why windy is there is basically because that's when all the pollen gets carried around. If it wasn't a very windy day, it will just be settling on the floor. Because it's windy, it's just being carried around and wafted through. So generally on windy days, you tend to get a lot more patients coming through your doors. And there are actually different types of pollen out there as well. You might be aware of this. There's tree pollen, there's grass pollen, there's actually weed pollen as well. And they're sort of released at different times of the year. So tree pollen is around about this time. So you're looking at spring. Grass pollen tends to be sort of the most common one, and that's sort of through spring and summer. And then you get the weed pollen, which is around about early spring to late autumn, to early to mid-autumn. But as I said, the most common one is grass pollen, and it's around about spring or summer when you get most of your patients coming in for help. So probably in the next month or so, July or so, you're going to get an increase in the number of patients who come through the doors. And the reason being is this grass pollen, and also the main reason being that is the most common reason behind hay fever. So what types of treatments are available? I'll be going over this in a little bit more detail with each of the products, but first of all, you do need to be aware that there's absolutely no cure available. It's like the common cold, you can't cure it. But what you can do is you can reduce the symptoms of hay fever quite substantially. The best thing you can do is to avoid exposure to the pollen in the first place. But unless you're a recluse, unless you've got nothing better to do with your life, it's really not realistic. You can't stay indoors, you can't stay in air-conditioned rooms all day. You do need to get out and about. So it's really, I mean, that's the ideal thing, but it's not realistic. The most common products that you've actually got are the three here. So you've got antihistamines, corticosteroids, and we'll go over each one of these in a bit more detail, and something called chromoglycate. each one of these will actually help to reduce the symptoms of hay fever. But there are also other things that you as counter assistants can actually recommend. So, for example, you can't see it very well because this little thing here is in the way, but it's wraparound sunglasses, and those are the sort of things which cover the sides of your eyes as well. And the reason behind that, it actually helps to prevent pollen getting into your eyes from the side. It's quite a good way of doing that. Maybe not be trendy, but it's a good way of actually helping to reduce the itchiness of the eyes. Another one, again, not necessarily very practical, but if you can do it, that'd be great, is to change your clothes often. What tends to happen is the pollen tends to settle on your clothes quite a bit. And obviously, if you're in polleny clothes all the time, you're going to start suffering. And also, if you can, shower after you've been outdoors as well to wash all the pollen off. And and again, if say for example you've got no life and you can do this, then try and stay indoors if the pollen count is too high. So these are other sort of like non pharmacological or non sort of like chemical ways of helping to relieve hay fever symptoms. Now, I talked about hay fever, and here are some of the products that you can use to help treat your patients really. So the liquids, for example, this one here is called cetirizine. A more common version of that is Zyrtec. You might have seen that in your pharmacy. And generally it's suitable for over 6 years, and it's a non-drowsy form of antihistamine. So the idea is you'd probably give around about a 5 ml spoon in the morning, and that's your dose for the day really, and that's all you need. It's a one-off daily dose, and it's quite a good one to do, but it's in liquid form. You can get it in tablet form as well, and it's a good non-drowsy one. I'm sure you've heard of Benadryl. That's another one as well, Crevastine. Again, it lasts for 8 hours. You can use it 2 or 3 times a day if necessary. And the other one, again, is something called Piriton or chlorpheniramine. There is a difference between these two, mind you. This particular one can make you rather drowsy. So if you're having trouble getting to sleep at night, it could be a good idea to take this as well. But if obviously you don't want to take it during the day if it does make you drowsy. So the idea behind this is that you could take it up to, I think it's 4 to 6 times a day if necessary. And it comes in a liquid form, which you can give to children if necessary too. So these, there is also another one called Claritin or Loratadine as well, which I didn't put in here, but that's another one. So you've got four main types of antihistamines that are out there, and these are 3 main ones that you can give. And they come at varied doses. So Loratadine and cetirizine, the Claritin and the cetirizine tend to be a daily dose. These tend to be at multiple frequencies throughout the day. Pardon me. Now, there are other types of antihistamines. Let me go back a bit, sorry. These particular ones, the antihistamines, tend to be the first-line therapy. So, for example, if it's the first time you're recommending something to somebody, something like this will probably be the one that you would want to go for first. Now, if that doesn't work, or if the patient is suffering rather badly, you can go with some of the other products out there. Now, again, I'm sure that you've seen these as well. You've got Becanase and Flixenase nasal sprays. There are other generic versions equivalent to this. So this is beclomethasone, this is fluticasone as well. They're very similar sorts of products. The idea behind this is that these are nasal sprays. So if you've got a really, really bad runny nose, these sort of sprays can actually help to relieve the inflammation. They're based upon a steroid. And you need to use them quite frequently as well. So, for example, with beclomethasone or becadiase, you use that twice a day. And with Flixenase, which happens to be a little bit more expensive, but it's still very good, you use that once a day. So it's a bit more convenient, a little bit more expensive, but hey-ho, it does the job quite well. The only thing about these is that you need to use it on a regular basis. It's no good taking it as a one-off. You do need to use it quite often in order for it to have a reasonable effect. So, as I said, along with the antihistamines, which are these ones here, you've got the so you've got the nasal sprays here, which are the steroid-based nasal sprays. You also do have eye drops as well. Now, I've only put one bottle in here, one picture called Opticrom. There are various other versions of this as well. But the idea behind this is it contains something called sodium chromoglycate, and again it helps to reduce the redness and the itchiness of the eyes. So while these ones affect mainly the nose, if the eyes are a particularly bad problem, then this one here can be given as well. So to summarize the sort of treatments that you've got the antihistamines here, which are first line, then you've got the second line therapies, which tend to be the nasal sprays, the steroid-based nasal sprays, and the chromoglycate-based eye drops. Now there are other things out there as well. There are antihistamine nasal sprays as well. They tend not to be as good, however, as the sorts of like the steroid-based ones here. So if I were to treat somebody, I'd stick with the antihistamine first, then go with the steroid sprays and the chromoglycate. Now, if you're really, really bad, there are other things you can do. There are prescription therapies that you can use as well. So, for example, you can use steroid tablets, which can be prescribed. And the thing with steroid tablets, they reduce the inflammatory response, and they also reduce the ability for the ability for the body to react to these particular allergens as well. So the pollen is actually an allergen. So what it does, it actually reduces the sort of like the effects altogether. These are only available on prescription. You're not going to be able to get that without a prescription. So it's something just for you to bear in the back of your mind. If the nose is a really bad problem, you can prescribe, or you can give them like something like Sudafed or a nasal spray like Otrivine, for example. That will dry up the nose very, very quickly. The only problem with these ones are that you shouldn't really use it for too long. If you use it for too long, what happens? Your body starts to get used to it, and eventually what will happen is that you won't be able to function without taking that. So it's something that you really tend not to want to give for more than about a week or so. So if it's really, really bad, then you can give a decongestant in a tablet or maybe a spray form or something like that, along with these other products that I've suggested around here. And again, there is immunotherapy. Again, you're not going to get this without sort of a GP intervention, but there are other things you can use, and this is quite rare for you to go down this road here, to actually go to this stage. So really, what you're going to find is you're going to find people coming in for the tablets, the nasal sprays, the eye drops, the decongestants, possibly steroid tablets, but quite rarely the immunotherapy. But it does happen. Now, when do you need to refer? Now, believe it or not, there are times when you do need to refer to a GP when asthma gets when hay fever gets really, really bad. If you've given the patient the treatments that we've talked about earlier on, the nasal sprays, the eye drops, the tablets, etc., and you still can't control the symptoms of that, then it's time to refer on to the GP. Now, with hay fever, you tend also, well, there's increased incidence of asthma as well with patients with hay fever. So, for example, you might find is patients coming with hay fever who are a little bit wheezy as well. And if that's the case, then if the asthma is getting worse, then again, you might want to check it out. Or you might want to send it over to the GP. And there's also another condition known as sinusitis. Now, remember, we've got a lot of mucus building up in the nose. It's the ideal breeding ground for lots of nasty bacteria. And sinusitis is basically an infection of the sinuses. So, for example, if you get these sorts of things occurring, sinusitis might require an antibiotic. Asthma may require an inhaler of some sort as well. So these are another sort of things when to refer to the GP or to the pharmacist, in actual fact, as well, and possibly in your case. And finally, symptoms that are not typical of hay fever. So, for example, if you are getting hay fever symptoms and it's out of season, and you're really only at home, when you get it, it's probably not the pollen that's actually causing it. It could be that you're living in a very dusty environment. It could be something else. It could be that you're allergic to your dog, or I don't know, something like that, or your parrot if you have a parrot. So these are the sorts of things here when you might want to refer to the pharmacist. If it isn't typical of hay fever, if it isn't on a sunny day, or for example, if it's not on a windy day like we discussed earlier, and if they're only at home, then there's something not quite right there. Now, there are other risk factors as well for hay fever. If you have asthma or eczema, you tend also to have an increased chance of having hay fever as well, which is not a nice combination, but unfortunately that's the way it is. There is actually a genetic component. So if your mum or dad or your sister or your brother have hay fever, then you're more likely, unfortunately, to have it yourself. So there is actually a genetic component involved as well. And there is actually recent evidence which suggests that if you're exposed to tobacco smoke early in your childhood, you're more at a chance as well of getting of hay fever as well. So all these sorts of things are risk factors as well. Now, there is actually another note here as well. Now, it's not always pollen that causes these symptoms. Remember earlier we spoke about not typical hay fever symptoms. You can actually be allergic to fungal spores as well, which are released throughout the whole year, and they can cause symptoms which are similar to hay fever. So they're not actually, there's not actually hay fever because hay fever is for pollen, but they can give similar sorts of symptoms as well. So it's not actually hay fever, but it's actually an allergy caused to fungal spores. And remember we talked about things like the dusty house and those sorts of things. That can also cause hay fever-like symptoms as well. So anybody who comes in with runny nose, itchy eyes, etc., don't necessarily assume it's hay fever. It could be other causes behind it. So you do need to investigate that a little bit further. Now, final slide. Now, there are some tests for it. Again, this is not something that you're likely to do in the pharmacy, but it's something that you're probably going to be referred, the patient's going to be referred to the GP. So there are two things here. There's a skin prick test. And what it does in the skin prick test, if you're allergic to something, they'll put a lot of these different allergens onto your skin and see which one makes you break out into a rash. And that will give you an idea of what you are allergic to. Now, there is actually a more complicated one, which requires a blood test, and that's for something called IgE. I'm not going to go into what that is, actually an antibody, but I'm not going to go into that. But the idea is it will test for certain types of IgE, and you would only really go for this if you've got severe or unusual complications, which is unlikely in hay fever, but it can happen. So really, to summarize, I'm just going to go back to the beginning. What we've done is we've spoken about the sorts of, what causes hay fever, the sorts of symptoms of hay fever as well. We've spoken about the sorts of treatments that are available, the antihistamines, the steroid sprays, the eye drops, and the decongestants, when to refer, the various risk factors, and also remember to assume that not every single person who comes through your pharmacy at this time of year is going to have hay fever. They can be allergic to other things. And we've also finally spoken about the diagnosis, in other words, the skin prick tests and the blood tests as well that the GP is likely to perform. Now that's going to be it for me now. I'm going to open up the floor now to other questions, so just bear with me a minute. I'm just going to do something. Okay, so I'm going to open up the floor. Does anybody want to ask any questions in the meantime? You can either type it in the chat window, or you can speak it out loud. I've unmuted everybody. Okay, I'm not getting anybody coming through. Is that clear to everybody? Do you want me to go over any particular part of this again? Okay, nobody's responding. So I'm going to assume that that you're okay with this. It will be on the website in the next couple of days. So please look out for that. If you want to go over it again, it's going to be there as well. And if you do need to contact me at all, you've got my number here. It's 0208-863-3335. That's the Pharma Plus number. And you've also got my email address as well. So if you've got any burning questions, then do feel free to ask as well. We are doing another one later on this evening as well, if you want to attend. We've got a slightly more complex version of this for patients who suffer from asthma and inhaled corticosteroids. If you do want to attend, then give us a shout and we can put you onto that as well. So I'm going to stop talking from now on. Again, if you've got any questions, then do let me know. We are pretty early today. We've taken about half an hour, so I will see you this time next month. Okay? Take care now. Bye.